Do you find yourself consuming excessive amounts of salt? Are salty foods like French fries, sausages, and processed snacks hard for you to resist? If you have high blood pressure, hypertension, or spend most of your day sitting without exercising, thinking your medication alone will control your hypertension could be a dangerous mistake. It's time to reconsider. In this discussion, I'll highlight 5 critical and common mistakes hypertensive individuals often make. If you or someone in your family is guilty of any of these, it's essential to act quickly, as these missteps can lead to severe health complications. Hypertension is more than just a condition. It's a major risk factor for death worldwide, surpassing smoking, diabetes, obesity, and even high cholesterol. Hypertension operates like a ticking time bomb within the body. Left unchecked, it can silently wreak havoc, leading to life-altering complications such as heart problems, e.g., heart attacks, angina, heart failure, strokes, both ischemic and hemorrhagic, kidney disease resulting in reduced organ function, eye damage, including potential vision loss. Shockingly, hypertension is often asymptomatic. Unlike what many believe, it doesn't usually cause symptoms like nosebleeds, headaches, or chest pain. This lack of warning signs means many people remain unaware they are hypertensive, increasing the risk of severe consequences. When was the last time you measured your blood pressure? Many patients can't recall. It may have been years ago, or worse, never. According to medical guidelines, all adults over 18 should measure their blood pressure at least once annually, even if they feel perfectly healthy. Regular monitoring at home or in a clinic provides vital insights into how hard your circulatory system is working. When blood pressure rises, the heart must work harder to pump blood, increasing the likelihood of heart diseases. The brain becomes more vulnerable to strokes, which can cause disability or even death. Blood vessels age and stiffen, elevating the risk of cardiovascular mortality. Hypertension affects 35% of adults, over 60 million people globally. Many lack access to proper health care and are unaware of the dangers. Sharing this information with friends and family can save lives. The most common mistakes made by hypertensive individuals can worsen their condition and escalate their risk of complications. These include poor dietary habits, lack of physical activity, reliance solely on medication, and failure to monitor blood pressure regularly. Mistake number 1 is the most frequent and most dangerous, so stay until the end to learn about it. If you find this information valuable, don't forget to like this content, as it helps spread awareness to those who may not have access to doctors or hospitals. Join the conversation. Are you hypertensive or know someone who is? Have you encountered these common mistakes? Share your thoughts in the comments below, including where you're from. Let's tackle hypertension together and take control of our health. 5. Failing to measure blood pressure properly or not measuring it at all. Measuring blood pressure at home is a crucial aspect of managing hypertension. Do you have a blood pressure monitor at home? Is it properly calibrated, and does it have the in metro seal to ensure accuracy? It's essential to check your blood pressure regularly, at least once every 15 days, or, as I recommend to my patients, twice a week at different times. This practice is vital because it's the only way to know whether your medications are effectively controlling your blood pressure. Regularly measuring your blood pressure gives you a sense of control over your condition, allowing you to track how non-medication changes like exercise, diet, and sleep are positively impacting your health. When you see that your blood pressure has improved, e.g., dropping from 14 to below 11, it can be a great motivator to continue with your healthy habits. It's also important to note that measuring your blood pressure at home differs from doing so at the doctor's office. Some people experience white coat hypertension, where their blood pressure rises simply due to the stress of being in a clinical setting. On the other hand, some people might have masked hypertension, where their blood pressure appears normal at the doctor's office, but is high at home. Regular home measurements help your doctor better track your condition and tailor your treatment accordingly. How to measure blood pressure correctly at home. To get an accurate reading, follow these guidelines. 1. Preparation. 30 minutes before measuring, avoid smoking, drinking coffee or caffeine, and exercising. You should also make sure your bladder isn't full. 2nd posture. Sit comfortably with your feet flat on the floor and your back supported. Rest your arm on a flat surface, such as a table, at heart level. 3. Cuff size. Ensure the cuff is the correct size for your arm. If you're obese, you may need a larger cuff for an accurate measurement. 4. Resting. Before taking the measurement, sit still and rest for about 5 minutes. 5. Measuring. After the initial reading, you can take a second measurement to verify the accuracy. Remember, measuring twice a week is a healthy and important practice, but be cautious of misinformation, such as relying on smartphone apps that claim to measure blood pressure. These apps do not provide accurate results, as I found out with one of my patients. He was using an app on his phone which showed a reading of 12/8, but when I measured with a digital device, it was actually 18. Such discrepancies highlight the importance of using a certified, reliable device. 4. Measuring blood pressure. Too often, while it's essential to monitor your blood pressure regularly, measuring it excessively is also problematic. Extremes are never ideal, and constantly checking your blood pressure can lead to unnecessary anxiety. For example, some individuals may feel the urge to measure their pressure whenever they experience symptoms like a headache or agitation. This can create a cycle of stress, as fluctuating readings can increase anxiety. One moment it's 11, then 13, and they worry it will rise to 18, leading to thoughts of a stroke. This kind of stress only worsens hypertension. Stress itself constricts blood vessels, which raises blood pressure. It's similar to squeezing a garden hose. The tighter you squeeze, the higher the pressure. Measuring your blood pressure constantly can cause this cycle of stress, making it harder to control. Instead, focus on overall trends. If you get a high reading due to a temporary factor like poor sleep, caffeine, or stress, don't panic. One isolated reading doesn't define your blood pressure. Instead of obsessing over every reading, measure your blood pressure twice a week, or as your cardiologist recommends, whether that's once a week or every 15 days. Do it when you're calm, relaxed, and not under stress. If you're stressed, your reading will likely be inaccurate. So, take away this key point. Don't let constant measuring increase your anxiety. Your mental health is just as important as controlling your blood pressure. Keep your focus on your long-term health, and remember that occasional fluctuations are normal. 3. Adjusting your medication without consulting your doctor. One of the most common mistakes I see in my office is people adjusting their medication on their own when they notice their blood pressure is high. For example, some patients may increase their medication dose without understanding that their current dose is already the maximum effective amount. I've had patients come in saying, "I was taking Benar 40, but my pressure was still high, so I doubled the dose." What they don't realize is that doubling the dose won't make a difference. It can increase side effects, raise costs, and even have harmful effects on their health. The proper course of action is to visit your doctor and discuss your treatment. If needed, your doctor can add another medication to better control your blood pressure, rather than simply increasing the dose of one drug. This approach avoids overloading your body and can be far more effective. There are also situations where someone may not even have a hypertension diagnosis, but after experiencing stress and seeing a high reading, they decide to take their spouse's medication. They don't realize that what works for one person might not be suitable for another. For instance, the medication I prescribe for women differs from what I would prescribe for men, as treatment is highly individualized. The growing trend in medicine is personalized or precision medicine, where treatments are tailored to each person's unique needs rather than following a one-size-fits-all approach. Self-medicating or altering your dosage without medical advice can complicate treatment and even cause harm. Instead, if you're stressed and your blood pressure spikes, the right response is to calm down, rest, and recheck your blood pressure after 15 to 30 minutes. If it's still dangerously high, such as 180/120, seek immediate medical attention at the emergency room. Always consult your doctor before making changes to your treatment plan. 2. Relying solely on medication and ignoring lifestyle changes. While medication is a critical part of managing hypertension, it's equally important to make lifestyle changes. Many people assume that taking their prescribed medication means they don't need to change their other habits. However, this is a misconception. You need to play an active role in managing your condition. For example, reducing your salt intake is crucial. Opting for light salt, which contains 50% potassium, can significantly help. Potassium counters the harmful effects of sodium by helping your body excrete excess fluid. Studies, including a major 2021 study in Circulation published from China, have shown that light salt can reduce the risk of stroke, heart attack, and even dementia. In addition to reducing salt, consider avoiding sodium-rich foods like processed meats, yellow cheeses, sausages, snacks, and sodas, including diet sodas. Increasing your intake of fruits and vegetables, which help normalize blood pressure, is essential. Avoid smoking, reduce or eliminate alcohol, lose weight if needed, exercise regularly, and ensure quality sleep. All of these actions combined can have a significant impact on your blood pressure. Over time, your doctor may even reduce or stop your medication if your condition improves. 1. Stopping medication. When your blood pressure appears normal. A common mistake I see is patients stopping their medication because their blood pressure is normal at a given moment. For instance, if a person's blood pressure is 110/70 in the morning, they may skip their medication, thinking it will drop too low. What they fail to understand is that the medication from the previous day is still working. Modern antihypertensive medications have long half-lives, meaning their effects last for hours after you take them. You should not decide whether to take your medication based on a single blood pressure reading. The newer medications aren't designed to drastically lower blood pressure. Instead, they work to normalize it. This process is gradual and helps stabilize your pressure over time. In fact, a study called the Pianist Study demonstrated that when people took a fixed dose of 3 combined antihypertensive medications, perindopril, indapamide, and amlodipine, their blood pressure gradually stabilized over several months. People who were mildly hypertensive saw their pressure normalize, and even those with severe hypertension showed significant improvement. For this reason, if your blood pressure is normal on a given day, it's still essential to continue your medication as prescribed. In some countries, such as Brazil, only 10 to 20% of hypertensive patients are well controlled, while countries like South Korea have a much higher rate of success in controlling hypertension, 72%. Maintaining good blood pressure control reduces the risk of serious health issues, including stroke, heart attack, heart failure, kidney failure, and premature death. By avoiding these 5 mistakes and staying committed to a comprehensive treatment plan, you can successfully manage your hypertension and improve your long-term health. If you found this information helpful, make sure to like the video and subscribe to stay updated with our latest health tips and advice. Together, we can promote awareness and better health practices. Have any thoughts or questions? Drop them in the comments below. Thank you for watching, and I'll see you in the next video. Stay healthy.